Welcome to Nexus Medical Media. In this video, we are going to talk about scar formation, right? So in the previous video, we talked about the phases of wound healing from hemostasis, inflammation, and proliferation, right? So the scars, where exactly do they come from? The scars occur when repair cannot be accomplished by cell regeneration alone. The non-regenerated cells that are secondary to severe acute or chronic injury, those non-regenerated cells are replaced by connective tissue. And, about 70 to 80% of tensile strength is regained at 3 months. Like within the first 3 months, we have about 70 to 80% of the tensile strength. However, little tensile strength regained thereafter. Right, so this is where the problem may occur, right? And usually these scars are associated with excess transforming growth factor beta, right? So there are two types. We have keloid and hypertrophic scar. These are the main ones we talk about here. Keloids, usually we find these on if someone is trying to do the ear piercings, or someone has just shaved and then there is this itchiness, and then with no time you see there is a very big and disfiguring wound, or probably a scar, as you're going to see later. And also we have this hypertrophic scar, which looks a little bit cleaner, right? So let's see what's happening exactly. You see, this is a linear scar line. In this wound, there was no infection. This was just a clean wound, and you can see a normal scar. It's a linear scar, right? That's perfectly normal in most of the cases. However, if there is a wound infection, there could be a hypertrophic scar, but this one is limited to the area of injury, as you can see here. And the worst part is this keloid, and this one is actually genetically predisposed, and it extends to normal tissue, right? So look at these three again. This is not everything, but it just gives you an idea of what generally happens. And there are different factors that are also involved in addition to wound infection on the hypertrophic scar and the genetics on the keloid, right? So let's go a little deeper, looking at this in form of like differentiating the two, right? Hypertrophic scar versus the keloid. Right. In terms of collagen synthesis, there is increased type 3 collagen in a hypertrophic scar. However, in a keloid, it's not only type 3, but also type 1. And this is even more increased compared to hypertrophic scar. In terms of collagen organization, in a hypertrophic scar, there is a parallel arrangement of collagen, right? But here in keloid, these are disorganized. In terms of the extent of the scar, in a hypertrophic scar, these are usually confined to the borders of the original wound. But if you look at a keloid, this extends beyond the borders of the original wound with claw-like projections, typically on the earlobes, as I said, on the face, the mandible, the upper extremities, the sternum. If we talk about recurrence, there is infrequent recurrence of hypertrophic scar, but on keloid, this is very frequent. And on predisposition, there is generally no predisposition for the hypertrophic scar, but there is a higher incidence in keloid if we talk about people with a darker skin and also genetics, right? So this is again trying to expand it more. Right, so this is the person who he just got he cut himself during shaving, and look at the result. It was just a small cut, and then it expanded, boom. Okay, so hypertrophic scars, usually these are non-vascular, non-tender, and generally there is no itching, and their natural history is to regress. But if you look at the keloid, these are usually vascular, and they are tender, and there is itching, they are raised and firm, and they have higher water content and higher content of glycosaminoglycans. It's also important to note that their natural history, the keloids, is to progress, unlike the hypertrophic scar, which will usually regress. These are other differences between the keloid and hypertrophic scar. These you actually need to know. I took them from the SRB manual of surgery, right? So you have to go through this page, right? I just took the ones I talked about in the previous slides. I took them from here, right? So as you can see, there is genetic predisposition in the keloid and nothing like that in the hypertrophic scar. And also in terms of a site of occurrence, a hypertrophic scar, you see that it occurs anywhere in the body and commonly in the flexor surfaces. But keloids, they want to be around the sternum, the upper limb, the lower neck, the ear, right? Another difference which I actually wanted to put out here is in terms of treatment, keloids actually have poor response to treatment, but hypertrophic scar, they have a good response to steroids, right? And natural history, I showed you that, right? So you can pause the video, take a screenshot, and go through these differences. They are very important. This is how you treat hypertrophic scar and keloids, the corticosteroids. You can also use bleomycin. Dressings, you can put pressure dressings, silicone dressings, laser therapy, cryotherapy, or surgery. But just to remember, keloids, they are very difficult to treat. Even with treatment, they start to recur, and they are very disfiguring in some cases. And people who have keloids, sometimes they are depressed people because they don't know how to get rid of this, because generally it's not always a clear cut on the treatment of these, right? If this video was helpful, thank you so much. And if you enjoyed it, please make sure you subscribe, share with your friends, and leave a comment in the comment section. Until next time.